Sure. So my name is Chemuttaai, originally from Kenya. And in my day job, I work as a regional business leader for healthcare social enterprise, which is a mouthful. But what we are doing is bringing novel healthcare interventions to different parts of the world using partnerships, using co-creation with various groups, including governments, entrepreneurs, and other healthcare organizations to make sure that we are addressing some of the biggest needs across low and middle income countries. Sure. So I think one of my biggest accomplishments in life is that I'm a mother of two super energetic children. I have an 11-year-old son and an almost 8-year-old daughter. Love to travel. So this year has been a little tough. I love trying new foods. I love meeting new people, seeing how different cultures interact with each other. I'm also an avid gardener. And on my weekends and nights, I have an organization that I help run focused on women empowerment and STEM leadership. So from a very early age, I was very much interested in design of everything and would try to figure out how things were built. And my parents really nudged me on and encouraged me to pursue a technical track as I joined high school. And I grew up in Kenya and I went to a mixed boarding school. So when I went on for university, I applied for the mechanical engineering program. And as soon as I started that program, I realized I was missing a little bit of the physiology and biology side. I was always interested in medicine, very much interested in how healthcare could improve lots of challenges all over the world. And halfway through my program, realized that, well, mechanical engineering was a great direction. I needed to adjust the biomedical engineering to become biomechanical engineering, the mechanical engineering to biomechanical engineering, and started going down that path. And by the time I graduated, I knew that I was going to be in the biomedical fields. And then when I went on for graduate school, I pursued biomedical engineering, really looking into the sciences and applying very well-researched techniques to improving science and healthcare. And I went on to work at NASA, the Johnson Space Center, as my first job out of university. And I did a job as an engineer. I was a system safety and reliability engineer. And my job was to make sure that whatever we flew up on the space shuttle or onto the space station was certified for the space environment. And I did that for 5 years. And then I transitioned over to Medtronic, which is largest medical technology and services organization in the world. And I started working on implantable devices for the heart. And that took me on to what I'm doing today, which was initially a side volunteer project, which initially started as a competition, an Africa Health Innovation Competition. So what initially started as a competition transitioned into a global health initiative effort. And eventually we were able to demonstrate viability of the business. And so they set up Medtronic Labs, which is the organization I work in now, to be able to actually build up solutions and scale healthcare enterprises across the countries that we are working in. And I pursued an executive MBA where I went back and with the technical knowledge I had, was able to pick up more of the business acumen and knowledge. So a day in the life of what I do is hard to define. Each day is different. One day might be helping set up operations with my operations team. But one of the projects that came across last year, as soon as the pandemic became a big issue, especially in the March timeframe, when we realized there was going to be a shortage of breathing therapies and breathing equipment, was the Coventor project. They had reached out to Medtronic and also to Boston Scientific as industry leaders to help them with some of the design aspects of quickly coming up with an open source design for an assist device, not a main ventilator, but one that could be used in a temporary phased approach as you are waiting to be placed onto a ventilator. One of the things that they pulled me in on quickly was as we were trying to figure out the needs across the world and where we might be able to provide manufacturing capability and link those in need to some of these new technologies. So if you're familiar with the ventilators, those are very sophisticated equipment used to help people breathe. During the COVID pandemic, one of the things we came to realize was the shortage of ventilators as patients worsened in their conditions and needed to be placed on the existing set of ventilators. What need we were trying to address with the Coventor project was the need to provide a range of breathing therapies that helped support this shortage by providing something that could be used in a temporary manner and something that was portable and something that could be used to replace the mechanical bagging that you would see with an ambu bag or a resuscitator bag that is typically done by either your nurse or caregiver before you're placed onto a ventilator. As much as there were shortages in the developed world, there was even less in some of the countries, with some countries having 10 ventilators for their entire population. So they then did was after the different design teams had contributed, the team that was driving this took it for FDA review, and it was the first FDA approved bridging ventilator of its type, which in and of itself was a renowned effort given the timelines and given how critical the need was. And what was interesting was this project really had us all hands on deck, had so many different teams come together to build something innovative quickly to address a need. But as the pandemic continued, I think one of the things that we came to realize is the aspects of building up the distribution channels, aspects of market accessibility and who would pay for it to be manufactured quickly came to rise. We had the opportunity to now, as the whole team that was involved in it, be able to share the designs openly with anyone who would like to build it. We've had engineering schools in different countries that we were working with start to use it to understand how do you quickly innovate, what does simple design look like, what does elegant design look like, what does frugal design look like. And so at the end of the day, it did serve its purpose. It is available should it ever be needed. However, I think at this point, we've learned a lot about the pandemic and what works and what the needs will continue to be. So one of the biggest learnings was the smallest things that you think might not be related, you may find are actually related and necessary for you to still learn and pay attention to in class as you continue in the area that you are interested in.